If you have those small red, blue, or purple spider veins on your legs, you may have wondered, can they actually be treated without surgery or injections? In many cases, the answer is yes. I'm Dr. Yuri Yagodin, and I've been treating spider veins with laser technology for about 20 years. Over that time, I've performed thousands of treatments, and today I want to explain how the Cutera CoolGlide laser actually works. And today, I want to explain how the Cutera CoolGlide laser actually works. First, let's talk about what spider veins are. These are small, visible blood vessels located close to the surface of the skin. They're extremely common, particularly on the legs. They can be red, purple, or blue. And although they're usually a cosmetic concern, some people simply don't like the way they look, especially when wearing shorts, skirts, or bathing suits. The CoolGlide uses a 1064 nanometer ND YAG laser. What makes this wavelength useful is its ability to penetrate relatively deeply into the skin and target the blood inside the vessel. The laser energy is absorbed by the blood and converted into heat. That heat damages the unwanted vessel while we try to minimize injury to the surrounding skin. Over time, the treated vessel closes down and your body gradually clears it. And here's something important that I explain to my patients. The vein doesn't necessarily disappear the moment I touch it with the laser. Sometimes you'll see an immediate change. Other vessels gradually become less visible over the following weeks as your body processes the treated vein. So, how does the treatment actually feel? Most patients describe a brief, hot, or snapping sensation with each laser pulse. The CoolGlide system uses cooling to help protect the surface of the skin and make the procedure more comfortable. Treatment time depends on how many veins we're treating. A small area can be relatively quick, while someone with numerous vessels may require a longer session. Another question I hear all the time is how many treatments will I need? There isn't one answer for everybody. It depends on the size, depth, color, and number of vessels. Some respond very nicely after one treatment, while others require additional sessions. And not every visible leg vein should automatically be treated with a laser. Larger veins, certain patterns of veins, or symptoms such as swelling, pain, or significant varicose veins may require evaluation for underlying venous disease. In those situations, another treatment such as sclerotherapy or evaluation by a vein specialist may be more appropriate. That's why I believe proper patient selection is just as important as the laser itself. After treatment, you can commonly have some temporary redness or swelling around the treated vessels. Occasionally there can be bruising, temporary discoloration, blistering, or other skin changes. That's also why the laser settings have to be selected carefully for the individual patient and the individual vessel. After approximately 20 years of performing these treatments and treating thousands of patients, one thing I've learned is that experience matters. Different veins respond differently. You have to look at the diameter, depth, and color of the vessel, the patient's skin type, and how the tissue responds to each pulse. The goal isn't simply to use a powerful setting. The goal is to deliver the appropriate amount of energy to the appropriate vessel while protecting the surrounding skin. So if you have spider veins that bother you and you're wondering whether laser treatment might work for you, the first step is an evaluation. We can look at the vessels, determine whether you're a good candidate for CoolGlide laser treatment, and discuss what kind of results you can realistically expect. If you'd like to learn more, follow me for more straightforward information about cosmetic and laser treatments. And if you'd like me to evaluate your spider veins personally, call our office and schedule a consultation. will determine which treatment is most appropriate for you.